So the Indian healthcare scenario is quite a contrasting landscape. At one end of the spectrum, you have hospitals that are delivering high-tech medical care in the urban centers, and as against that, if you look at the other side of the spectrum, you have the health centers run by government itself, which is trying to cater to the rural populace of India as well. So that's the wide spectrum that we talk about when it comes to healthcare in India. And when it comes to health tech in specific, if I have to put it in simpler words, I would say that there are the 5 A's that are the key challenges of the sector in India: access, awareness, absence of manpower, affordability, and accountability. These are the key 5 challenges, if I have to put it in short. India has, at this point become one of the leading destinations for effective healthcare services. And there's a lot of capital investment coming in, and technology infusion along with the expanded infrastructure, efficiencies from processes improvement. These could all help improve healthcare accessibility and affordability both in India. India's healthcare sector has a lot going on in several fronts. A government-led push to get healthcare providers to embrace electronic medical records is enabling AI to extract insights from patient data to deliver better treatments. The availability of telecom bandwidth is making medical expertise reach underserved rural market, which I talked about in the beginning, through telemedicine and teleconsulting programs as well. So, and again, delivery is happening over the mobile. So that's how the landscape is, and that's how much opportunities it provides, depending upon what end of the spectrum are you looking at this point. This is a very good and a welcome move, I must say. You need to understand that for an innovator, the upside in India is that he's very much likely to find a use case and a chance to pilot the new technology that they have come up with. You know, India is a country of or a land of pilots, as we know. The challenge is usually with scaling and distributing the technology, even technology that has been proven to be cost effective and useful. And I think this initiative will help answer these two problems. As I said, that one is scaling and distributing the right technology to the right set of people. Several pilots on public-private partnerships have been successfully done. However, none of them could scale up to meet the health challenges, the India's health challenges. So I think this will help probably take 5 or 7 good innovations from the innovators of India to probably to address the health challenges. Again, AI in particular has shown a lot of potential to leapfrog certain other technologies as well. But AI to be used at any scale, be it digitalization, is a prerequisite. So for us to see to it that AI does get used in healthcare, we need to see to it that we need to digitalize a lot of services that India provides. Um, at this point, a lot of Indian health centers still rely on medical records that are in paper form, or even radiology, for example, are in physical form. So that needs to change, and these kind of accelerators and will help take the next step. uh, Innovation, sustainability, scalable AI technology has the potential to greatly improve healthcare and its outcomes in India. And hence, this is a very significant announcement. So, we've also come across a lot of health tech startups that are helping, address these issues. For example, right from algorithms that are helping to analyze chest X-rays to other radiology images, to reading ECGs or spot abnormal patterns, or automatically scanning pathology slides. And these are a lot of technology that could be used to fill in this gap. The significant need for technology to bridge the resource gap in India and the potential of AI to offer affordable solution at scale means that there is a lot of potential for Indian startups to come in and deliver these technologies that the Indian healthcare system needs. With regards to the examples, I could quote examples at this point, and I'm taking into consideration the whole pandemic situation as well. One startup which is a team of engineers and researchers and designers from IIT Bombay called IU Devices has come up with a stethoscope, which is a Bluetooth-enabled digital stethoscope, which not only allows listening of chest sounds, keeping a safe distance for conditions like COVID-19 pandemic, but it also has an amplification, noise cancellation, analysis, and searching or sharing of heart and lung sounds for telemedicine purposes. Now, this is a brilliant innovation which has come out of one of the premier institutes in India, and I think they are scaling up quite fast with the product. They have also looked at UK market and catering to the UK market through one of the programs run by FICCI. The other example, again, as I said, I'm keeping in mind the pandemic and how these technologies not only are going to help during the pandemic but also beyond. 5C networks, it is one of the largest and the most trusted radiology networks in India. It aims at making quality radiology diagnosis accessible within an hour, and this could be done from anywhere in India. Again, this startup has done tremendously well. Their technology at this point has equipped more than 200 radiologists across India, and they are being able to, provide, their services to hospital and diagnostic centers in India, as well as to state governments, and again, reaching to the furthest corner of India. So again, both these examples are, highlighting the fact that affordable and accessible healthcare services through the use of tech is a possibility, and these startups would be able to cater and give that to the patients in India.